Hello, I'm Nancy Kline, a professor in the program of occupational therapy in the School of Health Professions here at SUNY Downstate. I'm going to talk to you a little bit today about aging in place. My objectives for today's discussion is to understand the assessment process and how that can be used to guide the plan of care for any individual, to identify the environments for aging in place and the things to consider, including environmental modifications, caregiving, and socioeconomic barriers. My final conversation will be about defining aging in place, the benefits of aging in place, and the challenges due to the aging process. Aging in place can mean different things to different people. It can mean aging in your home, having to leave your home but stay in your community. And what's most important is that the individual be able to make choice. Aging in place is the ability to remain in one's home or community as one ages. It's not limited to the person's current residence or situation, but instead the environment within which and the community within which they reside. In 2009, Medicare enrollees aged 65 and older were already aging in place in traditional communities. Most people are aging in place until a crisis in their condition or functional status or changes in family that supported them are no longer able to do so. Life's purpose is significantly associated with all causes of mortality, so purposeful living may have health benefits. Productive aging enables one to make valued contribution to one's own life by engaging in enjoyable, meaningful, and useful activities. It's associated with longevity, it benefits the mind, body, and spirit, and it promotes successful aging. Changes as in normal aging include things like decreased muscle strength, reduced mental processing capacities, increased risk of falls, increased risk of illness, reduced hearing and vision, and decreased mobility. Changes of aging impact our functional mobility in our home and community, our ability to drive safely, the use of transportation, both public and private, home upkeep, and health maintenance. Having a healthy lifestyle helps with healthy aging. So we can all practice healthy lifestyles now that will suit us better for the future. And this includes both positive attitude, so always thinking about the good, even though we acknowledge the challenges, eating smartly and healthy, social activity, practice being safe, stress management, physical activity, brain activity, financial affairs, and sleep hygiene. How can a healthcare provider such as myself support aging in place? I'd like to think that we provide person-centered care. So service delivery models that connect the types of housing with health services to support aging in place in the least restrictive environment possible is what we like to do. We identify and provide proactive support to older people living in the community with frailty, so that if we can identify people early, we can put different supports and structures in place to maintain their current level of functioning. We can provide care that meets the therapeutic needs of the individual rather than engaging in prescribed care, so that each individual has different needs based on who they are, where they live, their culture, their socioeconomic status, and we'd like to then individualize their plan of care for all those factors. And again, we want to provide culturally sensitive care to all groups. The ability to age in place looks at things like housing, health and well-being, finance, transportation, and networks of connection and support. So the continuum of care and housing environments that one may live in their adult life ranges from independent living to skilled nursing. Independent living is where we stay in our own environment, whether that's a home or an apartment. And to do that, sometimes we need supports of a home health aide. We may choose to go out to adult day services. We may need assistance for nutrition, including such services as Meals on Wheels, and transportation. If we move out of that environment, we may move into a senior living or assisted living environment. These environments do not have around-the-clock nursing. It usually does support a nurse or an LPN on site for 4 hours per week. And a home health aide is offered usually in the morning and the evening for activities of daily living and instrumental activities of daily living support. So they may come into a person's apartment and help them with washing up in the morning, getting dressed, and getting down to meals or making a meal in their own environment. And it would support instrumental activities of daily living, such as daily making of a bed, weekly laundry, etc. And assisted living, again, may or may not supply transportation. The issue with remaining in assisted living in the state of New York is that the person must be ambulatory. So if an individual chose to move into an assisted living, but unfortunately would become wheelchair dependent, they would no longer qualify for staying in that environment. They would then need to move to a more supportive environment, such as a nursing home that would supply 24-hour skilled care, and it may also supply rehabilitation services. Independent living is an option to live independently, should exist as long as possible, if that's what the person wants. So retirement communities cater specifically to older adults and offer diverse housing options, acceptance based on age and retirement status. Need for long-term care measured by assessing limitation to one's own capacities to perform managed activities of daily living and instrumental activities of daily living. And again, skilled care refers to the services that can only be provided by a certified professional. Independent living dramatically reduces health costs compared to skilled nursing facility. Naturally occurring retirement communities are neighborhood multi-dwellings or group of buildings in which residents are older adults. They evolve from existing communities and tend to be located in densely populated areas. When it comes to all that, can aging in place be done? We have to consider multiple factors. We consider how many floors or changes in elevation are there. We consider, is the dwelling a garden apartment or a split floor plan? We look at the issues of exterior steps. Are there steps? And if there are steps, are there handrails for the individual to stabilize on as they ascend and descend? We look at how compact are the main areas of the house, and by that I mean how far is it from the kitchen to the bedroom and the bedroom to the bathroom, and if the bathroom has a tub or shower that the person can access. And finally, is this your forever home? So many times people will purchase a home or rent a space that they consider living in during their child rearing years and then know that they will move out of later on. To stay in your home, there are many simple and easy low-cost modifications that can facilitate safety. Things like lighting, hallways and well-traveled areas should be very well lit because, again, many people as they age up have declining vision. And light switches also need to be easily accessible. So some homes are arranged where there's a light switch at the start of the hallway, but there's not another switch at the other end to turn it off or on. So if you're coming in the opposite direction, that would be challenging. But those things can be modified. We also look at the heights of furniture and the type of furniture that's in a place. Optimum height is that something is not too high and not too low, so that it's easy to get on and off of, and furniture type and placement. We don't want too much furniture because it would clutter the environment and make it more challenging for individuals to get around. We also look at where the furniture is placed so that there are big open spaces for mobility. We want to check that the furniture itself is in good condition so that there are no broken legs on chairs or tables, so that it would reduce the risk of injury. Often we recommend to people that they remove scattered and area rugs because they can become a trip hazard. And we also think about widening doorways or adding grab bars for accessibility. On this slide, we see a couch that has no armrests in the middle of it. So if an individual needs to use their hands to push off and up from a chair, you want to consider different seating arrangements. When we consider a bathroom and the ability to age in place, we want to look at, is the bathroom close to the bedroom and living room areas where the individual will be? We'll look at the entrance width of the doorway, and it would need to be a minimum of 24 to 30 inches for wheelchair accessibility, but it's more optimal to be 30 to 40 inches so that there's a little bit of space on both sides for someone to self-propel. We also want to make sure that in the bathroom itself, there's room to maneuver. So if a person needs to use their walker in a bathroom, can they get that walker in, turn it around, and get back out safely? We also look at tubs and showers. We look for ways to provide both accessible and comfortable bathing options. Walk-in tubs or showers are ideal. And walk-in showers means that there's no threshold for the person to step over. So if they're an ambulator, they don't have to step over anything and have the risk of falling. And if they use a wheelchair, they can get a shower chair that would just roll into place. Kitchen and dining considerations, again, staying healthy requires good, healthy eating. That we want to look at cooking tools and food items to keep them low enough to reach without a step stool, which is challenging for many people. We want to look at the accessible height of a counter. So accessible height means that if you need to be seated in a wheelchair or a chair to rest, the height of the counter should be about 34 inches to be able to prepare food. We want to, again, hope that the kitchen is both compact because that it's easier for the person to get around if they're an ambulator, but if they're in a wheelchair, sometimes a little bit more space will allow wheelchair mobility. We look at the ease of opening and closing drawers so that they should be good sliders. We look at things like lightweight tools. Many people use different sort of mixers and handheld mixers. Some of the older ones are heavy, but there are many newer ones that are lightweight. We also like to make sure to prepare and cook in areas that have good lighting, again, so that individuals can see what they are doing to reduce risk of injury. Stairs and multi-level homes can be a challenge, but again, they can be made accessible if a person has the means and chooses not to move out. So if you have a multi-level home, some homes you can put in elevators, others you can add on a chairlift option. We look at stepping down into living rooms or split level floor plans, Multiple small elevation changes can be challenging. Many places have a step-down living room and have no handrail. So again, depending on the situation, adaptations would be adding a handrail or ramping the step. When we look at entrance onto a porch or terraced area, again, we want to look at small and wide steps are best, and railings on both sides for the person to use to stabilize themselves and assist with balance challenges. New technologies that help monitor seniors are plentiful and continue to be developed. There are various systems. Some of the older ones that we're used to are a life alert system where the individual wears an alert on themselves that is set up to a base, and if they fall or need assistance, they can press the button on their life alert that will call the prearranged numbers in sequence, whether that's first to a family member, then sometimes if they're living in an apartment building, it may be downstairs to their main desk or to a super, and finally to 911. There are also many personal watches these days that have devices in them that can monitor fall risk and can have a GPS built in so that they can go out into the community. Life alert systems come in two versions, I should have said. One that's only in the home, and the second that does have a GPS again that can be used when someone goes out into the community. There are also cameras that can be set up in an individual's home that has a transmittal to the patient's family that they can kind of monitor their family member from a distance. On the bottom, you see a woman getting out of bed with what looks to be a rug underneath her feet, and that rug is actually a sensor so that when the individual puts their feet onto that rug, an alarm goes off, letting another individual in the home know that they're getting up so that they can yet have their independence, but someone can come over and walk them to the bathroom safely or wherever they want to go. When we age in place, we also want to consider various means in the community. We may have to look at in-home caregivers, which can often support families if they live with the individual and need to go to work. A caregiver during the hours someone is working is helpful, or if a family lives far enough away that they can't be there all the time, again, a caregiver can assist. Home support costs are much less than a nursing home, so again, many families worry about the cost of hiring a caregiver. Depending on someone's insurance, there is sometimes some assistance from insurance for caregivers. Some people have taken out long-term care insurance that support caregivers, and in either case, it is still cheaper than going to the nursing home. Also, if someone's unable to prepare meals at home, then things like Meals on Wheels or other organizations like God's Love We Deliver can support the person by dropping off several meals at a time and enabling them to have good nutrition throughout the week. The other thing that's nice about if someone requires meals is that it's another individual coming to their home or apartment that kind of is a check-in that they're okay. And the last thing we would look at again is transportation services such as Access-a-Ride, which is a funded situation that people have to apply for, go down and be evaluated for, and then if they qualify, Access-a-Ride can be set up where the person gets picked up and brought to medical appointments, to family members' homes for holidays, or to any other adult day center. When we talk about being able to stay at home, another consideration, again, are the socioeconomic barriers to staying at home and aging in place. And these are not just based on income, but also educational attainment, financial security, subjective perceptions of social status and social class. And it's interesting to note that about 14.5% of older adults live below official poverty levels. So when you talk about, again, socioeconomic means and being able to age in place, individuals 6 years older with low socioeconomic status who self-reported feeling lonely were found to be at greater risk for functional decline. And a lot of what that is because they don't get out. 1 in 3 persons with a chronic illness, which can be anything from arthritis, diabetes, asthma, cancer, COPD, stroke, hypertension, coronary heart disease, or psychiatric issues, and low socioeconomic status are unable to afford food, prescribed medications, or both. So they need, again, to somehow be brought into the system and be evaluated by a social worker who can help them navigate the system and find supports so that indeed they can maintain adequate nutrition and take the medications to maintain their health. Considerations for going into an assisted living are: does the facility offer special care units, such as those serving people with Alzheimer's disease? So some assisted living have memory care units, others do not, and which one would be appropriate for any individual depends on their needs. You would want to also consider, can residents choose their own doctors, therapists, and pharmacies? Some are all-inclusive inside, and some allow personal choice. Other things to consider are: under what condition would a resident have to leave the facility? I spoke earlier that if an individual is no longer ambulatory, they might have to leave the facility. Some facilities in the suburbs have it where the individual may be able to stay within their community but move to a different facility with more supportive care. And those situations are often desirable, where a couple would move into an assisted living. One of them then sustains some health issue that's requiring additional nursing support or caregiving, and so one may stay in the apartment that they started in, and one may move into a different building that's more skilled nursing. But yet they're able to visit each other back and forth because they're in the same community still. You also want to look at, does the facility specify all services provided by the facility, and or are there additional costs to it? So many assisted livings will provide assistance with medication management. However, often there is another cost associated with that. So you want to make sure you ask all those questions. You want to make sure if they standardly give you 2 hours a day of assistance for AM and PM care, dressing and bathing and washing up, and someone needs more, can you, again, hire that within, or do you have to go outside? And finally, you want to find out, if you're a pet owner, can you go into the assisted living with your pet? Do they allow cats, dogs, birds, etc.? Types of care a nursing home provides different and upgrade from assisted living or senior living situation is they will usually provide more extensive care for a person when they just get out of the hospital. Nursing homes offer help with custodial care, meaning bathing, dressing, eating, medication management, medical monitoring if they need their blood pressure or checked or their blood sugars checked. And it would also supply skilled care, include services such as trained professionals. It may include physical, occupational, speech therapy, and respiratory therapy as well. When you consider a nursing home, you consider a few more things. Does the nursing home provide the level of care the individual needs? If an individual has a respiratory status, does it have units for respiratory patients? Does it have units that supply oxygen or ventilators if need be? Does the nursing home meet local, state, licensing requirements? Does the nursing home meet state fire regulations? What are their visiting hours? If you're an individual who works and your family members in a nursing home, can you get there and with what frequency to visit that individual? And what are the procedures for responding to a medical emergency? So at what level can they handle it in that nursing home, and at what level does the person need to be transported out to an emergency room? And if so, what facilities are near you, and is there a doctor at that facility or have some permission to practice there? So in making all those decisions, we need to understand the person's physical, cognitive perceptual levels, as well as how they do taking care of their basic needs, such as dressing, feeding, toileting, grooming, bathing, and medication management. So we look at measurements and outcomes. And when I consider which measurement tool to use, I think of a couple of things. I think of how long will the assessment take me to give? If the person is acutely ill and probably going to get better quickly, then I don't want an extensive assessment that's going to cost a lot of money. I want something that will help me decide, can they return home? Do they need to go to a subacute rehab that's based in a skilled nursing facility for a while? Or are they now going to transition into some sort of senior living environment? If, on the other hand, I'm going to have a person in that subacute rehab or rehab situation, I may want to measure that's a little bit more accurate to change so that I can see how the person is doing today, but I can also use it for reassessments along the way to help the person qualify for additional insurance coverage for their rehab needs. When I talk about activities of daily living, they can include dressing, eating and feeding, toileting, bowel and bladder management, bathing or showering, personal grooming and hygiene, sleep and rest, and functional mobility. When I talk about instrumental activities of daily living, I'm now talking about a person's ability to manage their finances, prepare a meal, manage their medication, being able to utilize transportation, being able to shop for the food or medication they might need, their use of a telephone, and many, many more. So the instrumental activities of daily living are beyond the basic self-cares that someone with more cognitive or perceptual challenges may have a more difficult time performing. So I can look at different assessment tools. The modified Barthel assessment is an assessment of functional independence in the domains of personal care. So those very basics, dressing, feeding, grooming, bathing, and mobility. The nice thing is that it is a quick assessment. It only takes between 5 and 20 minutes, while it yet looks at 10 different personal care activities and helps me determine if a person can go home independently, go home with support, or if they're dependent for various activities, in which case they still might be able to go home, but with more support, or they may choose to go to a different facility.
The Barthel Index measures the extent to which somebody can function independently and has mobility in their activities of daily living. This assessment looks at feeding, bathing, grooming, dressing, bowel control, bladder control, toileting, chair transfer, ambulation, and stair climbing. The index also indicates the need for assistance in care based on the total score out of 100. It is a widely used measure of functional disability. The index was developed for use in rehabilitation patients with stroke and other neuromuscular or musculoskeletal disorders, but may also be used for oncology patients, older adults, or other non-specific patient populations between the ages of 18 through 65 plus. Last week, 26-year-old Allie went to the hospital after experiencing weakness and numbness in the right side of her body. She was diagnosed with left side ischemic stroke and stayed in acute care for 5 days, where she received both occupational and physical therapy.
Hi, my name's Jenna. I'll be your occupational therapy student for today, providing in-home therapy. How are you?
Good, how about yourself?
Great. Okay, so can you please state your first name and your birthday for me?
Allie Gallagher, March 1st, 1996.
Perfect. That is what I see here in the chart. Okay, so am I hearing and reading it right that you were in acute care last week in the hospital after having a stroke?
Yes.
Okay, so I know that you received both occupational and physical therapy, and I was just wondering if you remember what occupational therapy did and kind of what we do for you?
I remember more of the physical therapy.
Okay, well, we are a little different than PT, physical therapy. So basically what we do is we just make sure that you can accomplish the activities that you do in your daily life that are very meaningful to you. So this could be things such as basic activities such as feeding yourself, bathing, dressing, getting in and out of bed, that type of thing. And so my main goal is to see if we need to make any modifications in your house to make you be more successful, or basically go back to how you were prior to your stroke. So just to make sure, you had a left ischemic stroke and it seemed to affect the right side of your body.
Yeah.
Okay, so basically we see that your middle cerebral artery was blocked. So what that means is just the blood vessel in your head was clogged. So this can cause symptoms such as weakness and decreased sensation, probably in the right side of your body. Did you experience any of that? Are you still?
Yeah, I had a lot of that in the hospital, but not really anymore.
Not anymore? Oh, perfect. That's great to hear. So what about trouble understanding or getting speech out, trying to talk to people?
No.
No problems? Very good. Okay. So a couple questions before we get started with the assessment. Do you live alone or do you live with anyone?
I live with my significant other.
Okay, perfect. And do you have any other support coming and visiting you? Can they help you with getting stuff done if you need it?
Yeah, I have some good friends that stop by.
Good to hear. Okay, so are you experiencing any pain
No.
at this moment, or have you since you got home?
No.
Okay, very good. Okay, so basically what we're doing today is called the Barthel Index Assessment. So what this is we're going to try to see your level of independence with basic activities, like I explained earlier, eating, dressing, stuff like that. And I just want to see your potential for assistance and if you even need any assistance. And then we're going to just establish a plan and kind of see what goals we need to make, and it's going to be a very collaborative effort. Okay, so to get started, first I wanted to ask, do you feel stable? Do you have any fear of falling?
No.
Okay. And so first we'll just start with bathing. Have you taken a shower in your own shower since you've been home from the hospital?
Yeah.
Okay, very good. And how was that? How was bending down, the balance, washing your hair, your body?
I got a little unsteady when I went to bend down, but I think it was more just getting my bearings, and I didn't fall.
You didn't fall? Now, do you fear that in the future you might?
No.
No? You feel totally okay? Okay. And what about your bowel and bladder? So going to the bathroom, are you going regularly? Do you find that anything difficult with that?
No.
No? And what about wiping yourself?
No
Do you
problem.
have any trouble turning, getting down on the toilet? Okay. And how about transferring to the bathroom, onto the toilet? Any problems stabilizing yourself, getting down? Any loss of balance? No?
Not that I've noticed.
Not anytime since you've been home. Very good. Okay. And what about stairs? I know you live on the second floor of your apartment. And do you have any trouble getting up and down the stairs? And do you have any, do you get out of breath when you get to the top? I know that sometimes we do, but we're looking at how were you prior to the stroke and how are you now? Does it seem similar?
Pretty similar. I go a little bit slower now, but
Okay.
no real problem.
No problems? You think you can get up and down fine without any assistance?
Yeah.
Yeah, okay, very good. Okay, so now I want to just kind of see you perform these activities. So we're gonna start with putting on that jacket right next to you. I just kind of want to see what you do, how you do it. And I know that you probably have dressed yourself since you've been. Any trouble?
Again, a little bit slower, but no real problems.
No problems? Okay, good. All right, try to put it on and then zip it up for me. Let's see. All right, that's good. Perfect. Okay, now if you're too hot, you can take it off. That's fine. Okay, good. Now we will move on to the kitchen. I'm just going to see how you do some things, some butter, some toast. All right. Okay, so I know, and we previously talked about how you love toast in the morning. So I just want to make sure that you can use utensils and you can butter the toast just fine with no issues. So if you could just show me how to do this. I also love the Star Wars plate.
Oh, thank you. It's my favorite movie.
Is it? Which one's your favorite?
The first one.
It's a good one. It's a classic. That's good. Perfect. Okay, so now I'm just going to have you walk to the chair, sit down, get comfortable. Let's see how you do. Perfect. Great. And you could get up and let's see you get into bed, how you normally would at night. Get all comfortable.
And lay down.
And lay down, yeah, just to see how you do. Okay, perfect, great, looks great. And you can get back out of bed. Okay, great. Okay, so now I'm just gonna have you walk back to the chair, sit down. Perfect, beautiful, independent. Okay, so now I'm gonna have you sit on the toilet as if you're going to the bathroom. Perfect, okay, and kind of mimic wiping yourself and make sure you do it. Great. Okay. And have you had any trouble putting your pants back on, or doing buttons or zippers or anything?
I've been a little slower doing it, but I'm still able
But
to
it's
do it.
pretty functional. You can get it back on. You don't need any assistance.
No.
Perfect. That's what I like to hear. And also, laces on your shoes. Have you been able to tie them
Yeah.
all by yourself?
Yeah.
Perfect. Okay. So next, I'm gonna have you come up, stand up by the sink, and kind of mimic brushing your hair. You don't actually have to do it. That's good. Great. And have you had any trouble washing your face in the morning?
No.
Okay. Perfect. Any brushing your teeth? You can do all the movements but independently. No trouble there? Okay. Great. So I just want to see how you walk up and downstairs, and I'll be following you. So whenever you're ready. How did that feel? Good, good. And last question, do you think if you could you walk 50 yards? And that's about half a football field. Yeah, you'd be pretty independent now? Okay, great. Okay, so today was great. I see that you are independent in everything. And so next session we'll kind of go over results and maybe discuss some goals. We'll make some goals together for the rest of our time together. But thank you so much for letting me come into your home.
Yeah, thanks for coming.
All right, see you next time.
All right.
Talking about direct assessment of functional status. And that is where there's a observation-based checklist. And the purpose of this is to assess functional capacities of persons with cognitive deficits and have been used to indicate the severity of Alzheimer's disease process. So it may be used for evaluation and reevaluation, to assess decline in function, and to evaluate the effectiveness of pharmaceutical interventions on functional status. We use this on adults with Alzheimer's disease and different dementias, as well as older clients who also have schizophrenia. The CATS Index of Activities of Daily Living, again, is a relatively quick, easy to administer activities of daily living assessment that indicates the level of independence and the type of assistance an individual would need to carry out the activity. Because it's general, it is useful as a screening instrument for communicating the general patient function and, again, developing a care plan and specifically discharge plans. How much help will that person need? We usually administer it to older adults and those who are chronically ill.
The CATS Index of Independence and Activities of Daily Living assesses a client's activities of daily living using skilled observation. The CATS Index is available online for free downloads of the CATS Index form. There are no instructions or online components that correlate with the CATS Index at this time. We will be assessing 6 activities of daily living, including bathing, dressing, toileting, transferring, continence, and feeding.
Miss Garcia, do you need any help today?
No, I'm good, thank you.
Okay, I'm gonna shut the door for you.
Hello, I need some help.
Yes, Miss Garcia, what can I do for you?
Veronica. I just need some help washing my back.
Okay, go ahead and turn around. Make sure you're steadying yourself. Okay, so we're gonna bring it to here. We're gonna rock and stand on 3, ready? So 1, 2, 3, up. Okay, go ahead and pull it up. We'll stabilize you. Okay. All right, have a seat. And let's go ahead and get your jacket on. Okay. Miss Garcia, I need your help.
Right.
I can't reach that.
Oh, I have to go to the bathroom. Oh, I have to go to the bathroom. Oh no. Oh.
So today we observed Ms. Garcia. We'll date the form at the top and we'll include the patient ID number. Using the CATS Index of Independence and Activities of Daily Living, we then can see that it's divided into 3 sections. We have activities, independence, and dependence. If the client was able to do it with independence, they receive 1 point with no supervision, direction, or personal assistance. Dependence would be 0 points with supervision, direction, personal assistance, or total care. And again, it defines all of those as we go down the columns. For Ms. Garcia, she was independent in bathing and received 1 point. Dependent in dressing received 0 points. Independent in toileting received 1 point. Independent in transferring received 1 point. Dependent incontinence received 0 points, and independent in feeding received 1 point. At the conclusion of that step, we then add from top to bottom, going through all of the activities. So she would have 1, 2, 3, 4 points. So when we come to the total point section, you can see that the scoring is 6 is high, the patient is very independent, and 0, the patient is very dependent or considered low.
The kitchen task assessment was developed to practice an objective measure of organizational, planning, and judgment skills as performed in a common food preparation task. It provides information on the level of assistance necessary to support such performance, as well as recording change in the subject's function over time. It is used with individuals with various dementias and Alzheimer's.
Hi Stephanie, how are you doing today?
Hi, I'm good.
Good. So today we're going to do a little exercise, and it's called the kitchen task assessment, and basically you get to make pudding.
Okay.
Have you ever made pudding before?
No, I haven't.
Okay, awesome. So I'm just going to show you a few things that will help you make pudding, okay?
Okay.
So we've got a couple boxes of pudding here, and you can pick whatever flavor you want. We've got instructions here, or they're on the box. This is the stove, so to turn it on, what I want you to do is you're going to press in, and you're just going to turn it to wherever you need it to be to get your pudding to boil. Okay? And then that will heat up, so it's electric, so it's not going to be a flame. And then over here behind you in the fridge, if you look in the fridge, the milk is in the fridge.
Okay.
Okay?
All right.
And let's see. So I am not going to give you any cues unless you really need them. Okay? And then just go ahead and make pudding. Okay, and before we get started, I'm going to ask you if you can wash your hands. Okay, so there's a sink and soap right there if you want to wash your hands.
Okay. Okay,
Good
I
job.
haven't washed my hands. Number 1, pour 2 cups of milk into a medium saucepan. Number 2, stir pudding mix into milk in medium saucepan. Okay. Chocolate.
Number 3, bring to a boil on medium heat, stirring constantly. Okay, should we just wait until it boils and then
What do the
continue
instructions say?
Yeah, bring to a boil on medium heat. It's not boiling yet.
Read the instructions.
Stirring constantly. Okay.
Balls. So bring to a boil on a medium heat, stirring constantly. All right. It's boiling. So I'm gonna turn that off. Pour into bowls. Looks good.
All right, good job. Now let's sit down and talk about how you did, okay?
To score the kitchen task assessment, you will rank the client on a scale of 0 to 3, with 0 being independent and 3 being not capable, in the following components: initiation, organization, performs all steps, sequencing, judgment and safety, and completion of task. For initiation, did he or she begin the task when asked to begin? For organization, did he or she gather the necessary items, tools, ingredients, etc. to do the job? For performs all steps, did he or she do everything that was necessary to complete the task? For sequencing, did he or she do everything in the order that made sense given that task? For judgment and safety, was he or she safe and aware of potential dangers? For completion of task, did he or she recognize that the task was finished? This is a score sheet of the video's client and her ability to follow directions and sequencing. The information obtained from the administration of the kitchen task assessment will be helpful in obtaining objective information that the clinician can use in training the caregiver to assist the person with senile dementia of the Alzheimer's type in daily living tasks.
The Coleman evaluation of living skills, again, is an observational-based assessment that's quick and simple evaluation of a person's ability to perform basic living skills, and it can help determine the degree of a client's independence and suggest appropriate living situations that will maximize independence. So again, trying to help us make a decision based on evidence of the least restrictive environment an individual can age in. It's been developed to use on patients with short-term psychiatric challenges of the American culture, and it's a wider application, includes clients who are mentally retarded, geriatric patients, brain injured, or cognitively impaired.
This is the Coleman Evaluation of Living Skills. Good afternoon. I will be giving you an evaluation of living skills. The reason I am giving you this evaluation is to help determine your specific skills and to assist in intervention and discharge planning. It will take approximately 20 to 30 minutes to administer. I may be writing down notes as the evaluation progresses. If you have any questions, feel free to stop me at any time. At the end of the evaluation, I will go over the results with you. Are you ready to begin?
Yes.
All right. First, do this. While she is completing this portion of the assessment, I will also be observing her appearance. We will be looking for dirty hair, uncombed hair, ragged or torn clothing, clothing not fastened properly, unpleasant body odor, dirty fingernails or ungroomed hands, visible dirt on body, dirty clothing, obvious dental decay, or open untreated sores. Since the client has provided an answer for every section, we are complete. If she had not filled out the bottom portion, we would then ask these questions verbally. When scoring the appearance section of self-care, none of the listed items were present, so this client would be scored as independent for the appearance section. When scoring the frequency of self-care activities of the self-care section, this client was also independent since she showers or bathes more than once a week, washes her face more than once a day, washes her hair more than once a week, combs her hair more than once a day, brushes her teeth more than once a day, and eats more than twice a day. If she did not meet more than one of these items, she would be scored as needs assistance. I am going to show you 4 pictures. There may be a dangerous situation in them, or there may not be anything dangerous at all. Look carefully at each of them. You must decide if there is anything dangerous in the pictures. Do you see anything dangerous in this picture?
The cord is across the walkway.
And what is dangerous about the cord?
It could trip somebody.
Do you see anything dangerous in this picture?
Yes, he is standing on a book on a chair trying to reach something.
And what is dangerous about that?
He could fall.
Do you see anything dangerous in this picture?
No.
Do you see anything dangerous in this picture?
Yes, the hair dryer is plugged in with this sink running full of water.
And what would be dangerous about that?
Could get electrocuted if the hair dryer got wet.
When scoring the Awareness of Dangerous Household Situations section of Safety and Health, the client must identify all of the dangerous elements of the photos and why they are dangerous. Both components must be present in the client's response. If a client gives one or more incorrect answers, they would be scored as needs assistance. What would you do for yourself if you got sick with a cold?
I would go to the doctor.
What else would you do?
Take medicine.
Anything else?
Nope.
Okay. What would you do if you burned yourself and the wound became infected?
I would go to my doctor.
What would you do if you suddenly started having severe chest pains and shortness of breath?
I would probably call 911.
Okay, great. In an emergency, what telephone number would you call?
911.
If you needed to see a doctor, where would you go?
I would go to my doctor,
And who is your doctor?
Dr. Smith,
And where is his office located?
on American Pacific in Gibson.
And if you needed to see a dentist, where would you go?
I would go to my dentist.
And what is his name?
It is Dr. Jones.
Okay, and where is Dr. Jones located?
He's located on South H Street.
Okay. When scoring the identification of appropriate action for sickness and accident section of Safety and Health, the client must answer all 3 questions correctly. If one or more questions are not answered as provided, the client would be scored as needs assistance. When scoring the knowledge of emergency numbers of the Safety and Health section, the client must provide the correct local emergency number or locate it within a phone book. If the client is not able to do so, they would be scored as needs assistance. When scoring the knowledge of location of medical and dental facilities in the Safety and Health section, the client must be able to correctly provide the name of the doctor and dentist and where the offices are located, or find them within the phone book. If the client is unable to do so, they would be scored as needs assistance. I'm going to give you $2 and you're going to buy this deck of cards from me. The deck of cards costs $1.58 including tax. You give me the $2 and I give you the deck of cards and this amount of change. Is that the right amount of change?
No,
What would be the correct amount?
42 cents.
Now I'm going to give you $1 and you're going to buy this bar of soap from me. The bar of soap costs 23 cents including tax. You give me the $1, I give you the bar of soap, and this amount of change. Is that the right amount of change?
Yes.
When scoring the use of money in purchasing items section of money management, the client must complete both tasks correctly without using paper to figure out the answers. If the client completes one or both tasks incorrectly, the client would be scored as needs assistance. What is your source of income?
Student loans.
Okay. If your student loan check didn't come one month, what would you do to find out what happened to it?
I would go to the financial aid office,
What financial aid office do you use?
the one at my school.
Okay. Perfect. Now, how much money do you spend a month for food for yourself?
Probably about $200.
For the obtain and maintain source of income section of money management, to score as independent, the client must answer all questions correctly. If the client does not know what to do or does not know the location of an office, they would be scored as needs assistance. When scoring the budgeting of money for food section of money management, the client must state that they spend either cash or food stamps at least the amount allotted per month by the United States government food stamp program for one person with no income. If they do not spend that amount, they would be marked as needs assistance.
What is your monthly income?
I have $1,200.
Okay. Fill in this form by listing how much money you spend for the following categories each month. Do you have a checking account now?
Yes.
Okay, make this check out to Safeway for $17.88 and then report it in the proper place. Do you have a savings account now?
Yes.
Okay. Using this form, withdraw $20 from your savings account.
For the budgeting of monthly income section of money management, the client must give figures for at least 3 categories. The total of the figures must be no greater than the client's monthly income and no less than 90% of the client's monthly income to be scored as independent. If the client gives less than 3 figures or the total of the figures is greater than the client's monthly income, they would be scored as needs assistance. For the use of banking forms section of the money management section, the client must fill out the check, record it, subtract the amount from the register total, and complete all sections completely. If they are unable to complete all steps or make any errors, they would be marked as needs assistance.
What is the amount due on this bill?
$43.11.
When is this bill due?
August 4th, 1995.
How would you pay this bill?
With a check.
Where would you send the check?
City Electric Company.
For the payment of bills section of money management, all 3 answers must be correct in order for the client to score independent. If any of the questions are answered incorrectly, the client would be scored as needs assistance.
How do you get from one place to another in Las Vegas?
I drive in my car.
When was the last time you drove your car?
This morning?
Okay. If you needed to take a bus to a place that you had never been before, how would you know what bus to ride?
I would check a bus schedule.
Okay. What is the telephone number for the directory assistance or information? You may use the phone book if you wish.
The phone number is 978-750-8400.
Okay. Find the telephone number for Lucky Cab Taxi Company.
The phone number for Lucky Cab is 702-298-2299.
Here's the telephone number for the Regal Stadium Sunset Station IMAX Theater. Call the number and tell me what time the first movie will be shown.
The first movie shown will be A Dog's Journey at 12 p.m. Very good.
For scoring the transportation and telephone section about mobility within the community, the client is considered independent if both of the following conditions are present. 1. The client gives at least one method of transportation that can be done without any participation by another individual and does not require another person's property. 2. At least one method of transportation, besides walking, has been used within the past month. The client needs assistance if they only use walking for transportation, they do not leave the house, or all other methods require participation of another individual or another person's property. For scoring the basic knowledge of transit system, the client is considered individual if they can give at least one of the answers listed below. 1. Gives the number of the bus route closest to where the client lives. 2. Asks the bus driver. 3. Reads bus stop signs. 4. Calls transit information number. 5. Reads bus schedule. The client needs assistance if they do not know how to find out what bus to ride or gives an answer that would not enable the client to take the correct bus. For scoring the transportation and telephone section of use of a phone, book, and telephone, the client is considered independent if all of the conditions listed below are present. 1. The client gives or is able to locate the number for directory assistance or information independently. It is also acceptable if the client would call the operator or dial 0. 2. The client independently locates the number for the taxi company in either the white or yellow pages. 3. The client dials the telephone number for the recorded message accurately without assistance and reports the correct information from the message. If the client is unable to or needs assistance in any of these categories, they would be considered needs assistance.
Have you worked in the past?
Yes.
Do you plan on working in the future?
Yeah.
When was your last job?
About a year ago.
What kind of job was it?
I worked at the front desk.
What kind of job will you look for in the future?
Probably front desk again.
How will you find a job?
I'll look in the newspaper.
Okay. What do you do in your leisure or free time?
I like to play with my dog.
Do you do anything else?
I like to go for walks and ride horses.
Okay. Do you do any activities with other people?
Sometimes walking.
Okay. When was the last time you went on a walk?
About a week ago.
When was the last time you played with your dog?
Today.
And when was the last time you rode horses?
About a week ago.
For scoring the work and leisure section for plans for future employment, the client is considered independent if both of the following conditions are met below. 1. The client plans to find a job by one of the methods below: newspaper, signs in the windows, relatives or friends who have jobs to offer, employment office. And 2. The kind of job given by the client matches the education, skills, and past history of the client. This is determined by observations and information gained from the client, the charts, or others. It must be reasonable for the client to pursue the kind of job given. If it is not realistic or the client does not know how to find a job, they would be considered needs assistance. For scoring the work and leisure section, leisure activity involvement, a client is considered independent when both of the conditions listed below are present. 1. The client must give a minimum of 3 leisure activities, one of which is done with other people. 2. A minimum of 3 leisure activities must have been done within the previous month. One of these 3 must have been done with other people. If any of the conditions listed below are present, the client needs assistance. If the client gives less than 3 leisure activities, no leisure activities are done with other people, less than 3 leisure activities are done within the previous month, or 4 leisure activity was done with other people within the previous month. To summarize the results of the evaluation, a final score is computed. Each item marked as needs assistance is scored as 1 point, excluding the 2 items under work and leisure. Needs assistance scores under work and leisure are counted as only half a point. Independent, C note, and not applicable are counted as 0. A score of 5.5 or less indicates that the client is capable of living independently. A total score of 6 or more indicates the client needs assistance to live in the community. When a client has a score in the range of 5 to 5.5, the client has borderline skills for living independently in the community. Further information and evaluations by the occupational therapist and other team members may be needed to make recommendations about living skills and the ability to live in the community. The total score is used by the evaluator to make recommendations, but the total score is not actually recorded on the score sheet. The score, however, can be mentioned in the summary note if it helps to clarify the recommendations. After the final score is computed, a short summary note is written at the bottom of the score sheet.
Another assessment that I think offers a lot of good data for us to use is the Performance Assessment of Self-Care Skills, or the PASS. The purpose of this assessment is to provide data about daily living skills performance in a clinic or in a home. It establishes baseline functional status, and it measures change over time and at time of discharge, and it again assists in treatment and discharge planning by identifying the type and amount of assistance required for successful performance. It's used with adult populations in the clinic and at home. So the PASS, again, has 26 different tasks embedded in it, and one of the tasks that it looks at is medication management. Every task, the 26 tasks, can be given individually as standalone, or you can give a variety of the tasks over time. Fall risk assessment is another aspect we need to consider when deciding the least restrictive environment where the person can lead a productive and safe life. So all older adults should be receiving a fall risk assessment when they see their primary care physician. And the 2 quickest ones to administer are the functional reach test and the timed up and go test. Both have standards that are both age-based. The other thing is, after an individual sustains a fall, it's very important to conduct a thorough interview to determine the factors that caused it in a way to try to prevent it from happening again. So I can give you an example where recently an older gentleman who lives in assisted living in his own apartment and is quite private doesn't come out of his apartment very much anymore. He used to come out for 2 meals a day as well as attend various group activities. He liked bingo, he liked evening movies, he liked a lot of the musical performances. But over time, as his mobility has become more challenging, he's also chosen to self-isolate as a way not to fall. It then became known that he fell in his apartment twice before telling somebody, his daughter, on the 3rd fall. And both those times he fell while getting out of bed and going to the bathroom at night. He had many explanations for his falls, including saying that the bedding was sliding off the bed at night. But one of the other things I worked with him on was the fact that the environment, when he got out of the bed, There was a chair in the way from his bedroom to the bathroom, and so that increased, his ability to have to move around it at night when he was not fully awake, which increased his fall risk. I also found out over time that because his ankle was bothering him and it kept him up at night, he was often taking Tylenol PM, which makes you drowsy, which doesn't help when he gets up and goes to the bathroom. So assessing his fall risk was important to document that indeed he was an increased fall risk so that I could sort of explain that to him, and then treating him appropriately. And in his treatment plan, I worked on strengthening his lower extremities, I worked on his balance, and we also made environmental adaptations, including moving furniture out of the way, as well as he is now using an assistive device to walk.
In this video, we're going to be looking at the timed up and go test to assess fall risk in the elderly population. Hi and welcome back to Physio Tutors. The timed up and go test has been rated both 87% sensitive and specific in identifying elderly who are at risk of falls in a small-scale study done by Shumway-Cook et al. In the year 2000. To conduct the test, you need a chair, a stopwatch, and some tape to mark a line on the ground 3 meters away from the chair. To conduct the test, have your patient sit on a chair with possible walking aids at hand. Then explain the procedure to your patient as follows. When I ask you to start, please get up from your chair and walk at a comfortable and safe pace to the mark 3 meters away from you. Cross the line, turn around, and return to your chair and sit back down again. Could you repeat that to me? If your patient has understood the process, ask the patient to start the test. Once you ask the patient to start the test, you will start the stopwatch and only stop it until the patient is seated again. Okay, Kai, you may start. The patient is allowed 1 practice round and 1 round is timed. Amongst other risk factors, such as a history of falls, poor vision or certain medications, a time of 14 seconds or more during the timed up and go test, or if your patient appeared unsteady, could indicate a higher fall risk. Okay, if you're interested in more clinometrics or test protocols, you may check out our video on the trunk control test or the Baton score. If you like this video, make sure to give it a thumbs up and subscribe to our channel if you haven't. It helps us out a lot. Follow us on social media if you're interested, and I'll see you next time. Bye.
Good morning, Larry. How are you?
Fine, thanks.
Terrific. We're going to be doing what's called the functional reach test here, which is going to be a measurement to find out how far you can move your center of gravity forward without needing to take a step. Okay? We have this meter stick on the wall. It's at shoulder height. You're right-handed, so your right side is closest to the wall. Now, other ways that will get you ready for this test is based on your foot position. So I'm going to make sure that your legs are at hip width and that your heels stay on the floor at all times, even during the reaching part of this test.
Okay.
Does that make sense to you?
Yeah.
Okay, very good. Also, keep that left arm at your side throughout the whole course of this test. So in order to do the test, let's have you make a fist with your right hand and raise it to the height of the meter stick. I'll make sure your shoulders are square, and I'll take a starting measurement with my ruler here. And now I'd like you to reach as far as you can along the meter stick without touching it. Very good. I'll take a finish measurement, and you may stand up. Great job, Larry. That was great.
Thank you.
And here are just some very simple references that are good to go to if you're looking for any of these assessments or more information about aging in place safely. Thank you.